First of all, thank you for the honor, for the invitation to join this first workshop of this very important, I think, project of an education of interoperability, an idea that started a couple of years ago, that Enrique was the master of organizing such a big consortium of colleagues related to the field of education, and under Erasmus, he managed to accomplish such an important task. For me, it's a great honor to have you also here in Athens. I'm a professor of health informatics at the University of Athens. I hope you have visited the nice center of Athens, where you have the building of the opening of all the ceremonies are happening there. And also, I'm privileged to be also in EFMI as chair of the Certification Accreditation Committee. And as part of EFMI, as partners within the project, would like to thank you again for this honor to be here in this presentation. So, first of all, a few words about interoperability. We know that it's the most important thing that has to be done and to be accomplished in the field of digital health. Interoperability between digital health solutions is fundamental to allow health data to be used and reused in ways that enhance health and healthcare for European citizens. That crosses health institutions, healthcare institutions, and crosses around countries, and also has to be according to the rules of the European Union. Interoperability starts and ends in people. We, people, are involved in interoperability. We are going to gain all the benefits of interoperability. So it's a person's issue. If those creating, buying, adapting, and adopting digital health solutions do not know about interoperability standards in a progressively advanced manner, these solutions, especially electronic healthcare records, will never really interconnect and allow seamless flow of health data to ensure best care for everyone in Europe. It is a real must, and in order to be accomplished, it's not a technical solution only, but it's also a healthcare professions and the people's responsibility to be educated, learn, and implement the interoperability for the best of the healthcare system. So the people involved with the design, development, implementation, use must equally be upskilled. We know that the educational system, especially the healthcare, takes some time to absorb and takes new things happening in the technical world. And we need a continuing education to cover this at many stages. And also not only the healthcare professions, but also those implementing the development of applications, as well as the persons involved to take advantage of the interoperability applications. The digital transformation of healthcare is a process to be led by a well-trained clinical and technical workforce. Both have to be trained in this field. We know that the European health data space aims to facilitate data exchange between countries. Given that this data is generated by millions of professionals, it is essential to establish training measures at various levels to ensure a common understanding of data interoperability. So it's an important task that this project, the ZIA project, is going to be used across Europe to implement this great educational approach. So it is interoperability education and not education interoperability. So be careful of this terminology. It's a different thing. So we're speaking for this, in this term about interoperability education. So some historical background in the field of medical informatics, because we are part of medical informatics and health informatics, as we call it nowadays, because we are living the application side, which is the digital health. Everything started after the invention of computers. We have the terminology computers in medicine. We have the evolution of medical informatics in the 60s, and the evolution of imaging applications, of the early imaging applications. We have organizations that developed and bring together the experts in the field of medical informatics in IMIA, which is the International Medical Informatics Association, and EFMI, 1970s. And both organizations developed educational working groups because they thought from the early beginning that education plays a very important role in implementing the field of medical informatics or digital health as we know now. The German association, Regensburg, developed official recommendations how we are going to educate the new generation at that time of healthcare professions. And this is very important because this has been already degraded in the international associations, and these recommendations is the first step for international recommendations. We have a European approach for the Erasmus, the late 80s, which is after the Maastricht Treaty. We have the implementation of Erasmus across Europe. We have, for the first time, the introduction of the term health informatics in this country, in this university, University of Athens, that has developed the first European Erasmus Master Health Informatics program with the cooperation of 20 universities at the late 80s, 89, 90. We have at that time, because of this program, the first recommendation by the Council of Europe that we need to include medical informatics applications and courses in the curricula of medical schools and nursing schools, which is still a very difficult task to change the curriculum in medical schools to accommodate digital health courses. So why are educational documentations needed? Because we'd like to have a uniform way of presenting the field. The terminology plays an important role, as well as the competency that we are going to make the implementation across countries and across Europe, for example. And also we have to make sure that the quality of those programs are of high standard. So the International Medical Informatics Association developed many times education recommendations. The first ones came in the 2000, and this published by the famous paper at that time. And also we have recommendations of the educational curricula in 2010, and the recent ones are 2023. So they take into account the new terminology, the new applications, and the new fields that have arisen, like, for example, the artificial intelligence. But also, as we know, artificial intelligence is not a new one, it's an old one, but it has to be reinvented these years and be applied because of too many data, which is very important for applications of artificial intelligence, but also very high computing. So this now is possible to make the implementation possible. So we need to be educated also in this field with the curriculum. How these recommendations were developed of 2023, 45 very high caliber scientists and educators from the EMEA world were assembled for many years, about 2 or 3 years, representing various countries and continents, participated in different meetings, and also at the end, a task force make the implementation possible by writing up the recommendations and getting the approval of the EMEA General Assembly. So for 2023, we have the new recommendations. So I invite you to go and visit the EMEA website and download the recommendations. It's a very, very important document for any educational application in the field. The differences between the previous recommendations and the current ones is that the domains now are defined as in 6 domains. So we have the core principles in medical informatics, the health science and services. We have computer data and information science. Somewhere there is also interoperability, social and behavioral sciences, management sciences, and BMI specialization, which includes, of course, artificial intelligence. This is the famous now schema that we're using to make to show the biomedical informatics field, the digital health field, and with the 6 domains. So we introduce 3 levels of roles in the field. We have the user, which is very important. I think most of what we are going to discuss in this project is about the user level. We have the generalist, which sits between the healthcare profession and the institution, and also the implementation phase. So it's like a liaison between the technical world and the healthcare world. And the specialist, which is a researcher in the field, and it's quite a lot of knowledge to reach the research level. And also we have this schema, which is like a pyramid. I don't know if it's shown very well here, but yes. So we have the schema that the user is in the field of the lower level in terms of knowledge. It combines the knowledge of health science, computer science, and healthcare information management, but also it can reach the level of an undergraduate, the first year or second year of undergraduate. And also we have the second level, which is the generalist. Usually it is a graduate of a program in digital health and also a master's in the field. And the specialist, usually it is a research-driven master's and a PhD. So this is the definition according to EMEA of the roles in digital health. So in conclusion for this EMEA part, the educational needs are described in 3 roles. As mentioned before, the domains are 6, as described in the schema. The recommendation provided for dedicated biomedical informatics programs in an undergraduate and postgraduate level. So we are speaking about the academic level. The implementation of the recommendations can be applied in training programs and small programs dedicated to special institutions and healthcare domains. But mostly the description of those recommendations are dedicated to the academic fields. And regular revision, of course, is required in order to be updated as regular as possible. So from EFMI's point of view, now I'm moving now to the European area of European Federation of Medical Informatics. There is an initiative for accreditation and certification. So we try to control the quality of the programs that have been implemented in Europe. As you know, it is a very important thing. The quality of education is of paramount importance, ensuring adequate knowledge and skills. And this monitoring should be applied from the very beginning of education, so it's preemptive, developing the quality pathway towards capacity building of professions by medical and health informatics, or as we call it for the application side, the digital health. So we have developed a committee, this is the 7 people nowadays in EFMI that are discussing the accreditation process, and they're very well known, as you see. And for the accreditation, you should know there's a very diligent evaluation and monitoring of peer review process, ensuring that the education programs and institutions meet academic standards and operational integrity and quality. And it provides to the programs, a European added value by experts in the field. Because as you know, according to the rules of higher education in Europe, we need to have accreditation of programs by the ministries of education in any case. But those accreditations are more generic in terms of quality of infrastructure and following the rules of the law. But according to EFMI, we are going deep to see if the academic quality of the program is of adequate quality in terms of implementation of the recommendations. So we have 5 criteria of assessment. The needs and relevance of the program. If it is okay, it receives an okay. The second criteria is the intended learning outcomes. Have to be described fully. If they're okay, then it's okay. The academic teaching learning environment, so evaluating the environment and the academic personnel and the teachers. The organization and implementation, also very high importance. And also if the program itself has a quality assurance and development to support any issues that have arisen within the implementation of the program. If the five criteria are okay, then the program receives the accreditation certification. If 4 criteria are observed and not 1, then it gives a warning that we can give the accreditation only for 1 year, and then the committee has to revisit the program to see if the corrections have been made. So it's a strict procedure, as you all know about the accreditation procedure. The dean, the head of department has to be involved, the program director, all the faculty staff, quality managers have to be interviewed. The students themselves have to give the opinion to the committees of evaluation. The alumni are involved, the stakeholders, to see if this program is just for the academic world or is involved within the community and makes an application to the community, which is very important, not to live in an island. You have to live in the real world. The individual panel reports to the individually, then a consensus report is developed, and the consensus report has to be approved by the committee and the board of FME. Then the accreditation is provided. So for interoperability education, we need to educate a large force across health systems in advanced interoperability standards, the healthcare professionals, the IT professionals, the new occupations that are involved in the field. That's really important, and to have to not to leave somebody else should not be, how we call it, a niche approach, but has to be across the layman's as well. Create educators network to fluently implement micro-credentials element to degree of education. You have to establish a dynamic pan-European alliance, an ecosystem of doers and change makers for the sustainability, to update and lasting impact for the education for the next generation workforce in Europe. We also need to spiral up the educational experiences to larger ecosystem, promoting immersive educational experiences that foster the network of alumni as CA engines, and explore existing networks like Hospitals on Fire and networks of medical informatics educators across Europe to galvanize efforts towards cross-border interoperability in health. Also, we need to ensure high-quality training and education through accreditation and quality assurance credentialing measures based on international and European standards. So the project itself that Enrique will present is dedicated to advancing interoperability within the healthcare sector, particularly anticipation of the European Health Data Space Regulation through a comprehensive education initiative. ZIA aims to address the skills up gap in advanced digital health interoperability standards among healthcare providers, digital health solution providers, and of course, individuals. So I'd like to thank you very much, and I think you can continue now for the presentation of the entire project. Thank you.